I know I had PE.
Uh-huh.
I just don't know what's the difference between a
DVT and
DVT
a
and a
PE.
PE.
Okay, fine. Let me explain and then we'll start with your story.
Okay.
So, a DVT is basically a clot, a deep vein thrombosis, a clot in a vein. So, most commonly we see it on the veins of the leg.
Okay.
So, it starts there and then it can be dislodged.
Okay.
So, when the clot is dislodged, then the first place the most common place it goes to is the lungs.
Okay.
So, that's now when you get a PE, a pulmonary embolism.
Oh.
Yeah.
Then I had both.
Yes, I think so.
Yeah, I had both.
Yeah. So now that you had both,
Yeah.
tell us about your experience.
Hey.
Ulianzia wapi?
When they almost killed me.
Who's they?
Wamalisa mimi.
Wanapanga
Kunimaliza. Yeah, that one
Yeah.
was actually
Hey.
me. Okay, how did it start?
Yeah.
So, let me tell you, I wanted my skin to be glass.
Mm-hmm.
I wanted it to be like, wow.
Yeah.
So, I have like small, like not heavy acne, but I have like small acne.
Okay.
And I really wanted it to be cupped into
Glass skin. Yeah. Hi guys, welcome back to A Dose of Health, the podcast where I give you not too little, not too much, but just enough information to help you make an informed decision. My name is Dr. Hope Simiu, and today I have on set a lovely guest from the streets of Riara.
Oh, God.
And now we are here.
Oh, God, don't remind me. We are one.
Guys, you remember the theme song? I don't remember.
I remember it was a hell away from home. That's a
Why
remix
are we saying
did.
that?
That was a remix we did.
Oh, yeah. Hey, even had a remix.
It's supposed to be a home
Was it
away
that
from
bad?
home.
Have we introduced ourselves before we start?
Hi, Julie Nadupoi. Okay, what else should I introduce
Whatever
myself?
you want.
Okay. I love making life and living life with my friends. I'm a mother of one man, one woman. I mean, a mother. Wow.
I was waiting to hear what you're gonna say.
I'm a
Mother.
child.
Wow. Okay.
I'm a child of one woman and one man.
Wow.
Wow.
Whoever is watching, she's ready. She's ready.
And I have 2 siblings. Yeah, and I have lots and lots of friends.
That you do. Like
Whom I love all.
Mm-hmm.
And yeah, that is my. Oh, and the fun fact is I did bachelor's and master's in actual science.
Wait, both?
Yeah, my undergrad was a bachelor's in actual science. Then my master's was international master's in actual science.
Hey, my coffee. Wow, all that math.
All that math. That's the only thing I was good at.
It's so good is there, my student.
Oh, you know.
Star student.
That's a funny thing is I said I like in math once when I repeated.
You repeated
Class
what?
7.
Oh, okay.
Yeah, my dad told me you're not going to class 8 and I'm not paying school fees, so.
Ooh.
I know.
So you'd have been my year mate.
Yeah.
Aww.
So then funny thing, when I repeated is when math became my favorite subject.
Okay.
And that's defined my whole career.
Here you are now.
Can you imagine?
Who would have thought?
Big ups to my father. He knew what he was doing. At that time, I didn't know, but he knew.
Karibu sana.
Thank you.
Now, you seem very happy. A journey to Inside Out.
Yeah.
How are you feeling right now? Mentally, emotionally, uko wapi?
Feeling good.
Mm-hmm.
Mentally, a little bit tired, but it's life.
Mm-hmm.
Physically good. A little bit sore because of the gym, but we good.
Okay.
And spiritually amazing.
Okay.
Yeah, me and Sir God we're happy now.
In this life, you must.
Yeah.
Me, I don't know how you're surviving. Kama, you don't have God. Because
every day it's a battlefield.
Adulting. My God. Ay, sign me out. Sign me out. Did you go to the gym today?
No.
Okay.
But I go Monday to Fridays. Saturday is walking.
Okay.
Yeah.
Yeah, so it's okay. You don't have to be waking us up at 5 a.m.
No, it has to. No, it's usually 4:50. Then 5 a.m. is when you start. That's what
And
you
on
have
that
10
note-
minutes.
And on that note, 4:50.
You know, I make a joke like my school. I'm usually like a schoolgirl.
What time do you
By
sleep?
8:30, I'm in bed.
Oh.
Yeah.
Oh my good. I feel like I can close my eyes at 8:30 and my brain will be like, I'm awake. Whether you like it or not, I'm awake.
But you find out where you'll be tired because if you're waking up at 4:30,
Yeah.
your body's already tired.
Mm,
By the time now it's coming to like 7, it's like, okay, shut
that's
me
true.
down.
I think I started doing like just a bit of strength training. I'm trying, please, guys. I'm trying, and I can feel the fatigue. You know the fatigue you talk about, like as the day is going. I'm like, is it that I didn't eat?
Also, your appetite even increases because of strength training.
And then now you guys want to tell us proteins is everything.
No, honestly, it is.
Oh,
yeah.
Wow.
And then it's a lot of like. I didn't know like 60 grams of protein is a lot of food.
It is.
It is a lot of food.
I haven't gotten to the point where I'm measuring my food.
Which is a lot. Like, it's a lot of food. No, because you'll eat 2 eggs, you'll have chicken broth, and then you'll have 200 grams of chicken breast. Then you cook it.
First of all, that's the most boring part of the chicken ever.
Really?
Chicken breast. Oh my goodness.
That's
give me a fry. Or like a drumstick, you know? Yeah.
Or even, and then 200 grams of fish fillet. That's 160 grams. And with also cottage cheese added on top.
Oh, that's one day.
That's 160 grams of protein.
Aye, that's a lot. But actually, I was listening to a podcast, and there's, what's her name? Mel Robbins.
Yeah. Oh, I love her podcast so much.
And hi, Emma Grady.
I don't know who that is.
I'll put you onto Emma Grady.
Okay.
So she is developing her, together with like some scientists and doctors, a protein product that has enough protein for like one sitting.
Oh.
Yeah, because they realize it's so hard to get the protein requirements that you need. Like Mechoka, why am I still chewing? Like Jamini, please. It's enough.
I'm struggling with life. Let me struggle with my food.
So anyway, let's see. Then they'll release it for us. And she said it's going to be the door. When you're in public and then your phone is on
100.
It's
prayers. No,
it's your friends. You know, they're friends. You just can't listen to them in public. Anyway, it's okay. We forgive you.
Allowed.
So now let's get into a segment I call the patient seat.
Okay.
So just random questions. Don't overthink it. Just answer like this. So.
Damn. All right.
On a scale of 1 to 10, where would you place your trust in the healthcare system and why? The Kenyan healthcare system and why?
2.
Okay.
Sorry.
Okay. No, go on.
The funny thing, it's healthcare system. Okay, let me say 5.
Okay.
It's a 50-50.
Mm-hmm.
One is whenever I'm sick, I usually just go and say, please, what's the problem?
Mm-hmm.
But then my trust was what? Broken.
Mm-hmm.
So now I have to get second opinion all the time.
Okay.
Yeah.
Okay. That's a fair answer.
Yeah.
Okay. Next question. Patients or profits? Who do you think is a doctor's first priority?
Profits.
Guy, even without breathing.
But
yeah,
the doctor of the conversation we're going to have, he showed me it was profit. It was patient.
Okay.
Yeah. God, even his bill was very. I even said, wow, thanks.
Yeah. You're like, for real?
We'll go for
okay.
Man.
Okay.
Thanks. Yeah. And even the follow-up, So he's the one who showed me that. But the rest, profits.
Okay. We'll do better.
Yeah.
Promise. Next question. If you won a grant today, what's one thing you'd improve in relation to the patient's experience in Kenya?
Wow. Hey, questions are very wow. Okay.
We need the help, so we need to improve.
What will I improve?
Yeah. You can draw from your own experience.
I can't say knowledge, but I feel like we have very many great minds as doctors, but then sadly in this country it is the old generation that is holding on. So you'll end up finding like even the person, like that doctor that we're going to have discussed was an old doctor. Yet, because he's been in the market for so long, he's the one who is dominating the industry. But there are very many people who can give you very amazing experiences. Funny thing, even there's some friends of mine who are doctors at that time at Nairobi. They came and sat with me the whole time at HDU just to come and sit with me. So I believe I'll start a hospital for young people.
Okay.
Like just have all young doctors.
Yeah. Okay. We appreciate it.
Yeah, guys, I got you. So give me the money.
Yeah. First of all, Julie was telling us, hey, I don't know if I should even say this.
That's our secret behind
She was
cameras.
referencing some other figures over there. Yani, our eyes were just like, hey, tulipigwa na butwa.
Wow. Guys,
So as we are learning that lingo, so we can be in the right rooms.
Telling you, call me. Okay, don't.
Will call me, then I'll call her.
Yeah.
Okay, sawa.
You know that person who you'll call up someone, then they will pick up. But then if another person calls them, they pick up.
Okay.
Yeah.
Now you know, call me, I'll call her. Yeah. Then the last question. So the episodes usually go up on Wednesdays.
Okay.
And I'm trying to embrace our local culture kidogo. So Swahili Wednesdays.
All right.
Yeah.
Okay.
Ukitumia lugha ya taifa, tueleze mada ya leo. Na dalili moja ama mbili yake. The topic.
No, I was trying to remember what you were calling your Kiswahili teacher, then I've remembered.
Yeah, you remembered? Where? Moving on.
Ask your question now.
Okay. Focus. Ukitumia lugha ya taifa, tueleze mada ya leo na dalili moja ama mbili yake.
Mada ya leo?
Yes, the topic of the day.
Damn. Leo tunaongea. Tunazungumza kuhusu, I don't know what clots are called in Kiswahili, honestly. What are clots called in Kiswahili?
You would have said clotty.
I'm better off. Leo tutazungumza kuhusu damu kushikana. Groget. Na kuziba mishipa.
Mr. That one. Correct. Yes. We're talking about blood clots, so DVT and deep vein thrombosis and pulmonary embolism.
Yeah, what's the difference, by the way?
We'll get there.
Okay,
we'll
let's
get
go.
there. All right.
Says the person who was sick, but yeah.
Exactly. That shows we are failing on our part, by the way.
I know I had PE. I just don't know what's the difference between a
DVT and
a PE.
Okay, fine. Let me explain and then we'll start with your story.
Okay.
So a DVT is basically a clot, a deep vein thrombosis, a clot in a vein. So most commonly we see it on the veins of the leg.
Okay.
So it starts there and then it can be dislodged.
Okay.
So when the clot is dislodged, then the first place the most common place it goes to is the lungs.
Okay.
So that's now when you get a PE, a pulmonary embolism.
Oh.
Yeah.
Then I had both.
Yes, I think so.
Yeah, I had both.
So now that you had both,
tell
us about your experience.
Hey.
Ulianzia wapi?
When they almost killed me.
Who's they?
Wamalisa mimi.
Wanapanga
kunimaliza. Yeah, that one was actually me. Okay, how did it start?
Yeah.
So, let me tell you, I wanted my skin to be glass. I wanted it to be like, wow.
Yeah.
So, I have like small, like not heavy acne, but I have like small acne.
Okay.
And I really wanted it to be curved and to
glass skin. Yeah.
So what happened? So this happened in 2022.
Okay.
Actually, yeah. That's I'm like,
it's been a while.
Yeah, I know. I'm like, what happened?
You went to the doctor.
Yeah. So I went to this dermatologist that as I said, he's old. And I was like, okay, I went to saw him. He told me that 3 things disturb acne, hormones, genes, and bacteria. So I was like, okay, fine. So he prescribed me 3 medications. Till date, I don't remember how they are, but I know for the hormones it was a contraceptive, an oral contraceptive, and the other 2 some dawas. So I was like, okay, fine. I started taking them and everything. I remember that's the year I was graduating. I had graduated school, but because of COVID, my graduation was pushed forward.
Yeah.
So I went for my graduation, came back, and then still taking the medication. First of all, the medications are expensive, and then his consultation is expensive. I'll never forget. He depleted my outpatient cover.
Yeah, your cover.
He depleted it, and so. Again, I traveled again in July, came back. So the reason I'm saying traveling is because I was told that also links.
Contributes,
that also can affect it.
Yeah.
Then one day, I'm at home. No, I've lied. I'm not at home. Yes, I'm at home. I'll never forget because it was election. And our results were being announced. So I climbed stairs. Then I came down. No, I came down, then I went back up. Then I felt like I was a little bit dizzy. I'm like, okay, that's weird. But anyway, it is what it is. Then Tuesday, I was in the office. What happened? I went upstairs to wash something because there's a kitchen upstairs. I climbed into the kitchen and then I don't like milk tea. So it was that, you know how kitchen sometimes, office kitchens smell like milk tea.
Yeah.
Like it's like that's the only thing that can cook there. Milk tea only.
Yeah.
So I remember I walked inside feeling dizzy again. I came out. I'm like, okay, that's weird. When I said again, maybe it's the milk tea. Yeah. Anyway. And yesterday it was fatigue. You know, you give yourself excuses. Yesterday was fatigue. Today is milk tea.
Yeah.
So then I went to the gym. So this is where I was going to pocket gyms. And I was like, okay, fine. Let me go to pocket gyms. And it was nice. I got there, started working out. And then we were doing burpees as we ran. And I remember I had to come out because I felt like someone was putting a paper bag on my face. Like, first of all, pause. Are we allowed to drink water?
Yeah, you can drink water.
Penye wataka kunimaliza bila maji. We.
Why you think you're going to say, no, you can't drink water?
No, chupa is aesthetic. Chupa. So, we were doing burpees and I remember I felt like someone was putting a paper bag on my face because I'm trying to push air.
Yeah.
No,
you're suffocating.
I was dying. And then I had to go out, sit down. I'm trying. Then all of a sudden, the pain goes. No, the pain. It wasn't painful. The breathing problem goes.
Yeah.
So I'm like, okay, now that's new. That's not milk tea and that's not fatigue. That is new. So I went back. I told my trainers that. They're like, okay, yeah, that's a little bit weird. So you just do squats.
Where are those trainers? Come to the front.
No, I used to. No, I can't blame them because I used to complain.
Okay.
Wow. I'm like, why am I doing it? Why don't we do it? I'll still do it.
Yeah.
So they're like, let's do squats. So, but it wasn't jumping squats, just body weight. And I remember I figured 5. I said,
absolutely
I didn't come to die. No. Death is not an option. No. So I said I'll go home. So I went home and I was working out in the evening that time. Then I got home and I remember telling my mom, I'm struggling to breathe. Mom's panic. Go to the hospital now. You don't know what's going to happen. I'm like, Mom, I will go. So then following day I woke up, said...
Following day?
Yeah. See, but you know the funny thing is, and that's why for me the gym became from that day the gym became one of the most important places in my life because normal walk and small steps didn't change. I never got to know other problem. But then gymming is what now, because of that strenuous activity, it's what shifted me. So again, so I'm like, maybe it's just something related to the gym because I can still walk, I can still drive, I can still climb stairs, everything is normal. So the following day, woke up, didn't go to the office, texted the office, I said I'm not coming in. Then I went to the doctor. So I remember someone had told me, like, whenever you go to the doctor, carry your medications. Because whenever they ask you, are you taking any medication?
Correct.
I'm saying,
we don't know the blue pill, the yellow one, the white one.
Exactly.
They're like 500.
So I usually carry all my medication. And so that if someone asks me, do you take any medication? I'm like, these are the ones.
Yeah.
Is it nachukwanga? So I carried them. Then I went to Nairobi because Nairobi was the closest. Went, checked in, and then went to the nurse. I was taken to the doctor. The doctor says, okay, let's see if you have pneumonia. They're saying you're struggling to breathe. So, all right, fine, no problem. Went to pneumonia. Now, this time, I'm just chilling, for like, let's see what's happening here. Did my pneumonia scan. They didn't see anything. So I went back to the doctor. So the doctor says, okay, let's go to do an x-ray for your body. I think maybe this might be the reason. So at that time, I'm only talking to... first of all, I was alone. Never will I ever do that again. Wait, never again. Atakama I'm how 50, either my mom, my husband, or my children will be taking me to hospital.
Or your sister.
Or my sister.
Yeah.
No, those ones will cry with me. So I need someone who...
Yeah.
So they told me, okay, fine, we need to go do a scan. and then see, because he thought, now he didn't say what he thought,
Okay.
but it's like, maybe that might be the thing. So, okay, fine, I'm talking to my cousin the whole time. So I went, then the scan thing was in cancer ward.
Okay. Yeah.
I was like, all right, okay, then no problem. So I got in, they changed. Another time, I'm like, wait, okay, do I have cancer, honestly? Because where the hell am I in a cancer ward? So I enter, change into a gown, and then I'm put into this Grey's Anatomy, like, no, that's the best I can describe them, because they're like a dome shaped, and then I'm going in. So I'm just like, yeah, guys, this is where my lifespan has come to be reduced. So I got there, then the doctor, I remember the doctor, so, no, is it a doctor or a nurse? A nurse. So my eyes, and it's like, are you okay, Julie? I was like, no! I'm just like crying. I'm like, I don't know why I'm here.
They're not telling me anything.
Why am I in cancer ward?
Yeah.
Do I have cancer? Which cancer then? Which is a
yeah.
treatable cancer? Is it
Okay.
pancreatic? Is it
Yeah.
breast? Is it? I'm like, okay, can you imagine me with one boob now? It's just so many things go in your mind.
Yeah.
So then now he tells me, it's okay. Don't worry, it's going to be fine. Like, just chill. So I'm like, all right, fine, no problem. Then they insect a dye. And I think it's painful, actually. I didn't know it was that painful. So they injected a dye, then I was taken in. When I come out, this guy tells me, he says, Julie, let me ask, do you struggle to breathe? Are you asthmatic? I said, what happened to Julie? You're going to be fine.
Like, it's just getting worse.
What do you mean?
Yeah.
So he's just like, yeah, you're not asthmatic? Okay. All right, then. Yeah, just go outside, just go change as you wait for the nurse or the doctor to see you. I'm like, okay, fine. And that time now, I'm like, wow, guys, it's over. Like now it's confirmed I have cancer. It's actually confirmed.
Yeah.
So I went, changed, got back. Then I was talking to my mom. Then a nurse came and approached me. And then she's like, Julie. I'm like, yeah. She's like, we need to go see the doctor. I'm like, yeah, fine. I stood up. They're like, no. Here's a wheelchair.
Girl, sit down.
Enjoy the wheelchair.
Yeah.
You thought the wheelchair? This is for you, dear.
Yeah. You normally sit in the hospital, you're wondering who is it for? Today it's your turn.
And I'm like, I came walking. So what's, they're like, no. So I'm like, what's the problem? They're like, no. I told them, let me go pee. So I went to the room, I called my mom, like, listen.
She thought we were going to pee.
I told my mom, come now to Nairobi. Oh my gosh, mom, come now. Like, now is when you're coming to this. Now, this is where my adulting has come to an end.
Yeah.
This stage is where my adulting has said,
Yeah.
in initial stage,
Someone
sasa
take
itabidi
over.
mtu mwingine akuja achukue hii gari.
Yeah.
So my mom says, okay, she's coming. So I went, I was wheeled. Then you know that, first of all, that stretch from cancer ward to the emergency room for Nairobi is long.
Yeah.
So I'm there, I'm like, wow, it's over. So then they took me to an emergency room, like the one to the bed. Then they put me there. And then I see a woman who's making a bed for me. Let me tell you. I always say, that day my mind played some PE. Like, we had gymnastics, we had trampoline, we had hockey, because I did not know everything. The worst case scenario was playing in my head. And I asked now, I remember the doctor came, I was given a gown, I was connected to machines, then the doctor came and he found me like wailing. And then he's like, what's wrong? I'm like, no one is talking to me. And I find it very fair. I still think, actually, my grant for my hospital will be that.
Okay.
I find it very fair that, I know the nurses are not allowed to communicate to you what the problem is, but you're leaving someone like to, if someone's an overthinker, they will go crazy for all that. First of all, why am I from a cancer ward? So the doctor comes and asks me if everything is okay. I'm like, no, no one is talking to me. He's like, okay, fine. So just something that I actually feared. You do have clots in your lungs, and they have settled in both your lungs. So what's happening is you have a DVT, as you said, a deep vein thrombosis.
Yes.
So I had a big one that was there, that was breaking down slowly, then traveling now with my blood. Then my lungs will be the capillaries now to siphon it out. Where? Come here. Still for biology, Aburi. Triple science is not for free.
Oh, you also did triple
I did
science.
triple science. Whenever I go to the gym, I'm like, are you seeing my quad or my femur? So so then now he tells me that and they think that the main reason for my DVT is because of my contraceptive. So he even looks at me as like, we need to also talk to a doctor, but you take another contraceptives. I'm like, I wish it was for other reason, but it was for our skin. Like, it is for just good skin.
I feel so vain now, you guys.
You couldn't even tell my dad what medication got me there.
Why?
Because it's very hard to explain to, especially men.
Oh, okay.
Yeah. Why are you taking contraceptives?
But we need to normalize it.
Yeah, okay, but now with our generation, not with our parents' generation.
No, you start
We told him like later on,
Okay.
like this is the reason why I almost died.
Yeah.
So I laugh about it, and actually, guys, it was actually very bad because the doctor's worry was, that's why I couldn't walk. Their biggest worry was they don't know what my blood, if it has any clot, and any wrong move can go to my heart and block it. So that's the time now my family started coming in and everything, and the doctor came and told me that I need to be admitted in HDU for 4 days, just to monitor me and to control it and to be on blood thinners. And then also they told me that I'll be given anxiety pills. I'm like, me and myself, like, we don't have anxiety. What do you mean?
Weren't you just wailing?
I'm so strong. What do you mean? So, but I've never been to HDU in my life, and I've never been to ICU. I've only been to normal wards. Hey, I was wheeled inside HDU.
Yeah.
I said, I remember turning to the nurse. I said, "Yeah, those pills will work now." Like, yeah, those pills, you can bring them actually.
Yeah.
And I was bedridden for those 4 days. Again, I didn't know what bedridden is.
Okay.
And the following day, got there, I was literally bedridden. I could not move.
Yeah.
If it's a shower, I had a shower bath. I had a bed bath.
Yeah.
So that means I just.
You see, that's why we say nurses do a lot of work.
You feel even humiliated, like at that time, because also you're an adult at that time.
Yeah.
And then I felt worse because I didn't have any symptom. It was unless I ran.
Yeah.
Is when I'll know I'm sick. But breathing was normal and everything.
Yeah.
So I had bed bath. If I needed to poop, I will be brought for a bedpan. If I needed to pee, bedpan. And that happened for 4 days.
Yeah.
I couldn't, even like going for my doctor's checkups, everything, I would be wheeled the whole bed.
Why is the doctor not coming?
No, so now I had to do like, mama, like.
Oh, some tests.
Yeah,
okay.
like for the heart and seeing if anything is moving there. So of course the machines can't come all the way.
Okay.
And I remember asking why I was in HDU. They said that's the only place that can support machines.
Yeah.
And so I had to be attached into machines to be knowing if anything happens. That first night, for my oxygen dropped. Yeah, I think my oxygen was at 70 or something.
Whoa.
So I had to be put on oxygen. Again, I was thinking like, what, guys? But see, I'm just breathing slowly. Kumbe, my oxygen is dropping and everything. And so after that whole process, I finished. I left HDU. I was taking blood thinners in the morning and in the evening for injections. Even that's the time I knew that this is the best place to inject someone because that's where blood flows, like you have.
So depending on, how you're supposed to inject. So you can have like an intramuscular injection. You can have a subcutaneous injection. So normally your tissue around the stomach, it has like a thicker fat layer, and that's good for subcutaneous injection. So if you notice, the needle is not so big. It's a bit small.
Yeah.
So the tummy has like a good fat pad. So it's easily injected there. And of course your fat has quite good blood supply.
Yeah, because there or here. Those are the two places I was being injected.
Yeah.
Then after that now is when I went to the normal ward. And then I was told to stay home, I think, for 2 weeks or 3 weeks to monitor. I was not, it was the most, at that time, I didn't know what it was. I just laughed about it because I was just, again, I didn't have any broken leg.
Yeah.
I didn't have any broken arm or I didn't have anything. So I was just like laughing. But then mentally, it really, I didn't know how bad it was. Till like 6 months later, I was like, wow, that was actually really messed up.
Yeah.
And I remember even after I was on blood thinners for 6 months.
Yes.
20 mg, or I think the higher dose for to now nini, and I couldn't. That restricted me from traveling.
Yeah.
Because if especially my parents were more scared, if anything was to happen or even an accident happened, that's the end of my life because I'm not clotting.
Yeah.
So it was a very scary moment. Sometimes I laugh about it. Sometimes I'm just like, wow, guys, I almost died. Like, if I didn't go to the gym.
Have you seen that TikTok? I almost died.
Yeah, nah, like,
I almost died. And it's true, by the way.
Because I was like, if I didn't go to the gym,
Yeah.
I could have just slept, and then one thing could have just gone wrong, and then. So you know those stories where you hear someone has just lalad and then they didn't amka?
Yeah.
That will have been my story.
Yes.
And I think that was what keeps on. That was the most messed up mentally part of me. I'm like, if one, I thank God that he guided me, he protected me not to have anything.
Yeah.
But also now, if I didn't listen, then that would have been my story.
Yeah.
Yeah, damn, my
Well, thank God that's not the story.
We actually thank the Lord.
Yeah.
Yes, that's my story.
You know, I think for me, when I saw you talking about it, I think, did you do a recap?
I came back and then I went back home and then I did a 2 video, part 1 and part 2 video.
Yeah.
And I feel like that's when I wish my doctor, I'd had to make it aware, because funny thing, which I forgot to say, one day I posted on my social media story the medication I'm taking.
Yeah.
And 3 ladies DM'd me and said, are you seeing Dr. So-and-so? And that medication is 1, 2, 3, 4. I didn't say what I was going to see. But then they just knew which doctor I'm seeing because of the pills. Because also they were being prescribed the same pills.
Okay.
So now it didn't become a conversation, is the doctor being paid to push the drugs?
Oh.
Because now, how is it all of us are having the same medication? And then after the video I did, 7 babes also DM'd me saying, is this Dr. So-and-so? Is this Dr. So-and-so? I have the same medication. I have the same. And I'm like, okay.
Yeah.
Okay. So this is it negligence? Is it like pushing the drugs? Is it? So it was a very messed up thing. And that's where my trust goes off with now doctors.
I see that. I can see where you're coming from. Maybe just to answer that part.
Yeah.
I'm not saying it is or it isn't negligence, but for certain conditions, there's certain treatment. So we can have 10 people here with the same condition and they'll be on the same medication. I think maybe the missing point is, what are you being managed for? So for you, it was for your acne.
Yeah.
For them, what were they being managed for? I think that helps you decipher if it should have been prescribed or not.
But also he will have worked, why I feel like that as well is he will have worked with my gyna.
Yes.
He will have said, okay, before I give you contraceptives, I need to know if your body can take hormonal contraceptives. So even when a nurse came, I remember that day when I was in hospital, the nurse came and said, hi, Julie. I said, yeah. So we need to talk about contraceptives. So you can never take. I just feel like, ma'am.
Yeah.
Not this one. It was for my skin. Like I didn't have any other reason why I was taking contraceptives apart from my skin. So I wish he talked to my gyna to be like, is she? Because now I can never take. Now I know through that experience, I knew I can take hormonal contraceptives, and also I can't take any medication for that just alters my hormones.
Yeah.
And that's for me. I honestly, he really messed me up with trust with doctors, because I'm like, nigga, you almost killed me.
This thing is disturbing me. Sorry. Where is it? Let me catch it.
You look at it. There we go. Yeah, it reflex very quick.
I want to come back to something you've mentioned about him working with you, or is it a him? Him, she, working with your gyna.
Yeah.
100%. I think I agree. If you're going to be on treatment for anything that's hormonal related or affects your reproductive system, there should be a collaboration between the specialists that you're seeing.
Yeah.
The sad thing is, for clots, imagine we can't know sometimes until it happens.
Really?
Yeah. So even your gyna might have not known.
Oh.
Yeah. So there are certain risk factors that we attach to it, but then it's things like family history. So maybe if someone in your family had a clot before.
I'm first of my generation.
You see now. Yeah. So
first
now
of my generation.
It's the risk factors that would now help us determine if you fit the criteria or not. But imagine if you tick all the risk factors, you can still likely end up having a clot.
Damn, I've been hating the nigga for no reason. Been hating the nigga for no good reason.
So he might have not known.
Yeah. Okay.
Well, sawa. I think for me, how I came across your story, of course, I follow you on socials and but I remember you told us the story time, and it just somehow clicked in my mind that morning you went to the gym.
Yeah.
And I was like, how did you manage the gym? I was so shocked. And then also just because of how movement dislodges clots.
Yeah.
So now you saying you went up the stairs twice, not once. You were in the gym. I'm like, oh my gosh, my girl.
You're testing God. You are testing God.
I'm like, wow.
You are trying God. You are
God
trying.
said, my daughter is staying here with me. Well,
yeah.
Okay, fine. So let's talk about DVT. Let me just give a brief on it.
Okay.
So some of the risk factors, apart from now, clots is general. So let's talk about how you can get a clot. There's 3 different ways. So either you have a reduced blood flow, like stasis. Your blood is just haisongi sana. That's now where travel comes in. So you hear people who are going for like long flights, you're told don't sit the whole flight, stand up, move your legs, stretch kidogo, just so that at least your blood can be flowing. Number 2 is also after surgery. After major surgery, don't stay in bed. Like you have to walk, move about a bit. And if you can't walk, we'll do physiotherapy because you want your blood to actually move. So that's one cause. Then there's also a hypercoagulable state. That is, if you're in a state where you're now predisposed to getting clots. One is pregnancy. Yeah. So pregnant women, we are very high alert. And especially if you've had a clot in the past, during your pregnancy, for some people or some patients, they might be on anticoagulants just to prevent you from getting a clot. Number 3, contraceptives and hormonal contraceptives predispose you to getting clots. There's cancers. There's a number of conditions. So it's conditions, but also medication. So for me, the question that I always ask people is, when you're on medication, do you know the side effects? Do you know some of the risk factors around them? And I always encourage people, please don't leave the doctor's office without asking. Even if the doctor doesn't mention them, just ask. Just be like, so what should I be concerned about? Yeah, and if that happens, what should I do? Yeah. Then the third one is if you have like an injury to your blood vessel. So like if you've had for major surgeries, even like BBLs, you can have like a fat clot because you can injure like the blood vessels and then something is dislodged, goes into your veins and then goes into your lungs. Yeah, so there's a number of factors, and for you now it was the contraceptives.
Yeah.
Now, when you get a DVT, there's some deep vein thrombosis or a clot. There's some signs that you can see, of which I didn't hear you mention any.
Because I didn't have any.
You didn't have it.
My leg was not paining.
No leg pain?
No leg pain.
No swelling?
No swelling.
Really?
No.
Wow. Hey.
I'm telling you, this was yeah. My story. Sometimes I'm like, what?
Because now the leg pain is normally like the warning. It's like, okay, fine, that's DVT now. Let's control it before it becomes a pulmonary embolism.
I've had leg pain before because I also had... Can you hear my story? Well, because 6 months later, I had cellulitis.
From where?
Story of another day.
Okay. She'll be back, guys, to talk about cellulitis.
Exactly. So, topic cellulitis.
Wow.
Me 6 months later.
Okay.
Yeah.
Okay, so we have, normally there's swelling of the, and it's one leg only.
For me, it was this one, and literally it was the same leg. So that's what I'm saying. I know the pain because I felt like something was detaching. And I felt like, even when I went to hospital, they were telling me maybe they think it's a DVT that is traveling. Yeah, that's what they actually thought. That's why I'm like, I did not have that symptom before.
Okay, interesting.
Yeah.
Then sometimes also the color of your leg can change.
Nothing.
No, it wasn't even a hot. You feel like, hey, my leg is hot. Where? It's an enigma.
It was just chilling. Like, hi guys.
It was chilling, and then you're just there like, move with more activity.
Gym.
So now when you have a DVT or signs and symptoms of a DVT, so we investigate, but we also do a Doppler scan. So it's like a scan of the leg. You get to see the veins, and then you can see there's a clot inside the vein. Yeah, then if there's a clot, then now we treat you with anticoagulants. We tell you, do not move. Minimal movement. That's why you're told, wheelchair, sit down. Sit down, because we don't want it to go elsewhere. Yeah. Then if it dislodges now, of course, now it's managed as a pulmonary embolism, where you had the difficulty breathing, chest tightness. It feels like ni kama unafungiwa.
It felt like me and Cartoon Network I was seeing what was happening. I was like, damn, that's how Tom and Jerry feel.
Yeah. Yeah. And then sometimes you feel like your heart is racing.
Yeah.
Some people cough, and sometimes when you cough, it can have some blood.
Oh.
Yeah, so I think I'll just list some of the symptoms here so that you guys can see them. But then now the treatment is a bit different. So there you can be given anticoagulants, also bed rest, oxygen, depending on now how you're presenting, and even anti-anxiety medication.
Yeah.
And by the way, I was scared of medication.
Oh, well, I almost died because of it.
Hey, well, we'll move. No. We'll move on. Very fast. The other day, I was looking for Panadol at home because my dad wanted some. Then I went to ask an aunt of mine, does anyone have Panadol? And then she was like, I don't like medication. I'm like,
Well,
okay, I know, I get it. But if you're having the headache, just take the Panadol. Just take it. Your case is an isolated one. That one, tunaelewa, by the way. We understand.
But I do take medication. I'm not those people for write it out. No.
Don't suffer. Please.
Yeah,
don't
I can't suffer with the economy and then I suffer with my health.
Yeah. Hey, I'm putting that on a shirt. By the way.
Please give me any
Signed, Julie.
any money that comes. Give me some money.
Imagine for real. I'm putting that on a shirt. That's gonna be much. And you guys, please buy. It's going to be much.
I'll be the first to buy, please.
Correct.
Yeah,
correct. Yeah. Then after that, now, so why you went to the cancer side that you were saying, you went for a CTPA. So it's a kind of a CT scan that enables us to see into your lungs and the vessels in your lungs. Okay. So the dye that they put inside, it's just for visualization.
Yeah.
So it enables us to see clearly. And they found clots in your lungs. So now the clots, what the radiologist didn't tell you is just like, well, this one here has a PE. And I just can't tell her because I'm not the one to tell her.
Yeah.
So that's how we diagnose it. And it's normally very quick. We normally say, please, if you feel chest tightness, difficulty breathing, just run to hospital. Mm-hmm. We are not saying it's obviously a PE, but it could be, and a PE can take you out very fast.
Yeah. Very true. Yeah. But also, that's through that what I learned from people sharing.
Yeah.
My story was everyone was just saying, "Oh, damn, I need to be very careful in how my body reacts." Because I think, as I said, my first two options, you really pull it. You're like, there's nothing serious.
Let me just see tomorrow.
Yeah. Yeah. So I'm like, if I didn't go to the gym, then.
That's true.
Yeah. So that's what I always say. Yeah, even the cellulitis is the same thing. I'm like, oh, that's weird.
So you didn't learn? Samora, you don't learn?
No, but you never... Babe, I wasn't watching Arrested the previous night. What do you mean? I'm always doing something the previous night. Always.
Where? Wow.
Yeah.
He said balance.
He said, come.
Just come. Yeah, just come.
I need to use you as my example. But I think the reason why you don't know about it is because I never talked about it.
Yeah.
Because it was also now, not only after 6 months did I have some slight depression. Let me say dark moment because of being in hospital. Mm-hmm. Then you're telling me I'm back in hospital again.
Yeah.
Of another different problem that didn't even make me go to work for 1 month. It was, now I'm just like, hey, I don't even know how to share that because it's a lot even for me to process what just happened. Mm-hmm. Yeah.
Mm-hmm. And actually, how are you feeling when you had the cellulitis? Because why I ask is because cellulitis is, we call them differential diagnosis. So like if you have swelling in one leg, we're thinking infective, so cellulitis, we're thinking DVT. So how did you present when you had the cellulitis?
Wah.
That wah.
No, the
why I'm trying to use my inner voice.
No, the why is bad at my butt that I was so close to be amputated.
Julie. Okay.
Let me tell you, my parents, sometimes I had my dad telling me one day, you can't get a cold, Wankeshi, honestly. Hey. You cannot get a cold. Like, honestly.
I hope your insurance cover is good.
I remember that time. So every time I I'd say, I'm not feeling well. Whoa, everyone in the house panics.
Hospital.
Okay, guys, there's something wrong. Yeah. But my leg was swollen. Mm-hmm. It was red hot. Mm-hmm. It had you know, when you're bitten with a mosquito, then it creates something.
Yes.
Now that's
like a wheel.
Yes, so it had like that, most of it. Like this part of it was mostly this down part.
Okay.
And that's why we thought it was a DVT, because it was the same leg,
Exactly.
same area.
Yeah.
So they're like,
and these are similar symptoms apart from the skin.
yeah.
The swelling. Yeah.
So that's when then now my leg ended up turning into I'll have photos. When you're talking about that episode, I'll just give you photos to show how it changed.
Okay. And then your light skin.
Whoa. It became brown.
Mm-hmm.
Then the next stage it became red and then firm.
Yeah.
Before they were looking like very juicy. Now it looked like it was firm.
Yeah.
And I remember my doctor just kept on saying, "Why is that thing climbing? Why that thing?" That's why I was about to be amputated, because it kept on climbing. Even with I was taking medication through drip, it was still climbing. So thank God for one doctor thank God for my doctor asking for a second opinion before he does the amputation.
Wait.
Yeah.
Like they had to...
That was an option. So the other doctor said, "Oh, let's just try the traditional way. Wrap her leg like a burrito. Like wrap it very tight with many bandages. So that now to try to curb the bacteria. Then now attack it now from there." Then, because how we ended up knowing is when he unwrapped my leg, he sighed. He's like, me and my dad were like, nigga.
So the moment, as a doctor, even after the surgery has gone well, but it was tough. You go to the room and you're just like,
where? So the thing, when we looked at him, then my dad asked Wagwan. Then he said, "I won't lie to you, if this did not work, our next option was for us to cut her leg. Because if it ever passed here now, that's another story now." Yeah. I know, 6 months. Literally, I went back to the same ward. The mama was like, "Same room?"
You're rude, first of all.
Yeah,
You're
just
rude.
like, what do you mean, same room?
Oh my God.
Yeah.
Had you finished the anticoagulants at that point?
Yeah, okay. I just finished them in January. Then this happened in March.
Okay.
Yeah.
Wow.
Yeah.
Hey.
I'm a living testimony.
Living testimony. The lived experience itself.
It is me.
Wow.
Yeah, that's what happened 6 months later.
Gosh, and we thank God you're here.
With both legs.
Yeah, in the gym, telling us 4:50. She wakes up at 4:50.
Wakes up at 4:15 to be in the gym by 5.
1:05. 4:15.
Yeah, so I can be in the gym by 5.
Wait, why do you need 45 minutes to get to the gym?
No. First of all, I need 10 minutes to understand why I'm going to the gym.
Okay.
But it's not like...
Yeah, correct.
So I don't have to wake up like, wow, it's a brand new day.
Let me tell you, if you're going to work out, you just have to do 5, 4, 3, 2, 1, get out.
No.
Don't think about... That's how I wake up. I wake up like this. Because if I think about it, I'm not doing it.
You're not going? So I think now, because I'm like, I wake up, then I think about my life. I'm like, Then I pray, then I get ready. Yeah. Then now the gym is a 10 minutes drive.
Okay.
So let's just say 35 minutes of me being alive.
You're getting ready for what? Me, I'll enter the gym. You'll take me as I am in the morning.
But the way it will take you then.
You will take me as I am, by the way. Kama sijui, I didn't put roll-on that day. Me, I'm sorry, by the way. This is my hard, and I'm doing my hard.
Yeah, this is my best. And this is what I can bring for you.
Exactly.
Yeah.
Exactly.
You can't judge me.
Where?
Yeah.
All right. So let me finish about the medication. So when it comes to like DVT and PE, especially DVT, you have to take the medication for a minimum of 6 months. Yeah. And then some people can continue depending on your risk. So your doctor should assess it. So you have to go for that 6-month follow-up. Ulienda 6-month follow-up.
And they said, oh, it's not there anymore.
Correct.
No, that's for like, someone who was going.
Yeah. Hey.
You look like you've healed.
Yeah. But that follow-up is so important because some people get lost to follow up and it's still there.
Yeah.
So you still need to keep going to your doctor and make sure you know what is happening to you. Just try and understand. If you have questions, ask the doctor. Now, before we finish, I have a question.
Also, for the medication, even I remember my doctor said, because traveling was also a no-go zone for those first 6 months. But he told me after the 6 months, whenever I travel, I have to take contraceptives.
Hey, you want to go back there? She's even had an aha moment. She's like, woo!
I have to take blood thinners.
Okay.
So that whenever I travel, came back, he's like, okay, here's your dose of blood thinners.
So you have to go to him before and after you travel?
After.
After, just
after. After, yeah.
Okay.
So that's immediately after, like, that was that time, that's months. It's like, here's your dose.
And by the way, this is a disclaimer because I know there's someone who's going to come here and badmouth contraceptives. It depends on your risk.
Yeah.
It depends on your risk.
Just
We're
that
different.
Me got triggered, man.
Eh,
I need to go to therapy for it.
Yeah.
But yeah.
So please speak to your doctor. And that's why we say, by the way, don't just take over-the-counter medication.
Yeah.
You don't know your risk. You'll be there sitting, and maybe it's not even DVT this time. It's something else.
Yeah.
Just because you didn't fit the criteria. So please make sure speak to your doctor, your healthcare provider, and make sure the medication or the family planning that you're going to be on is the best for you. There's no one size fits all.
True.
All right. Now, before we move to beyond the clinic, I have a question. Maybe when you had your cellulitis, could you walk?
No.
Okay. Now, perfect.
I felt like a Barbie doll. Like I felt like someone wanted to touch this leg from
Yeah.
here. Like, yeah, yes, you leave your Barbie doll with one leg.
Now, for me, when I broke my leg, and first of all, that thing about the CT scan being in the cancer, whatever, because also went to Nerima Hospital.
You
And then it was the same thing. I was told wheelchair. Cancer. So you're just there in the streets
What?
of the hospital, and then everyone is looking at you like,
what?
what? And then for me, my leg was like this. So it's like, Hope, what happened? I'm just like,
Oh, poor girl.
I broke my foot. And then doing what? Playing netball. They're like, isn't that a no movement sport? I'm like, listen, you're triggering me right now. You're triggering me because if there was no movement, my leg would not be broken.
Yeah.
So next question. Yeah. But now during that whole time, I honestly saw why I can never take walking for granted.
No. Oh, yeah.
Where?
Me, I even had those ones for
Yeah.
the 4-wheel. Not even the 2, the 4.
I was so sorry.
That was my movement thing.
I remember something. No, for me, I had the crutches. And first of all, crutches are hard
Yes.
to walk with. Oh my God. Let me tell
Hey.
you, being the patient and experiencing the things you tell patients lightly. Like, it's okay, just use the crutches. Just. Where? I said it's not just.
Bro.
It's not. Your armpits hurt. Your
And then
elbow
here I am.
over. Wow. But let me tell you, I'll never I know we've digressed. But anyway, it's a time I was in the house alone and my parents had come. So they rang the bell. Me was in bed. So I want to get out to go and open the door. This leg cast over here crutch. The crutch just landed badly. The way niliteleza. And then you're trying to protect the leg that's injured.
You go with one leg.
But that leg touched down like this. I said, who? I'm telling you, I hit the other one. I was just like, this is how I don't walk again. Ever. Oh my goodness. Me, I just said, for differently abled people, wow, I think they need all the support they need because it's hard. And then this country is not built for disabled people.
Bro.
It's so hard to get around.
It's so bad. Like,
and I feel like that's something we need to address and have a conversation about.
it's not, especially being in England and seeing how everything is for,
It's favorable.
Yeah. And then in Kenya, it's a whole different story.
And then the ramp, they'll put for you an accessible ramp. I'm telling you that angle, I'm like,
By
accessible
the
for
time
who?
Yeah.
Well, anyway, thank you for sharing your story.
Thank you very much.
I hope we've learned something about DVT and PE.
Yeah.
And now let's
And
move.
cellulitis now even.
And cellulitis now, by the way. God, let her rest. Let her rest. It's enough. It's enough.
2022-2023 was a very
Wait.
funny year.
Hey,
Yeah.
anyway. But please continue your travels. We love the travels.
Thank you very much.
We love
yeah,
them.
clearly medication didn't stop me.
It didn't. And it shouldn't, by the way. Yeah. Good. Now, beyond the clinic, some random questions,
Okay.
and then we wrap up.
All right.
Ah, yeah. Number one. If you could... Oh, no. No, it's still going to be beyond the clinic. If you could share one health tip to your community right now via text, what would it be?
Listen to your body. Yeah, literally just listen to your body. I don't think we were made to suffer, but I hate suffering.
I don't think there's anyone who likes suffering.
No, but there are some guys who like staying in pain.
Oh, okay.
That's what I'm saying, suffering. Like,
Yes.
some guys will be like, I'm just waiting for the uchungu to wear off. Wear off?
No, it should not be there in the first place.
No, yeah, it's like me right now. There's a knee here. I had a problem. I went to insurance. Hey, yeah.
But it's once
May I-
bitten.
may
Actually,
I
twice
finish?
bitten.
My insurance.
Then now
I-
they just like, this Julie Nadupoi. They're like, she marks it out. Imagine.
So when I'm like, there's like a sting I'm
Yeah.
feeling on my knee. What is it? They're like, oh no, it's just like it's grinding kidogo, but it's
Yeah.
okay. So I don't let pain go. For me, if it's paining,
Address
I
it.
rush to the hospital.
Okay.
Yeah.
Correct. Then next, what is the first thing you do for yourself, either in the morning or the last thing you do for yourself in the evening, that's just for your sanity?
A gym. in the morning for my sanity. Hope is like,
Is it for your
you
sanity?
really, is it for your sanity?
Is it for your
honestly?
sanity? Am I because it's a must?
But honestly, it's for my sanity because even I hate it when someone tries to talk to me in the gym.
Okay.
Why?
Okay.
Why are you talking to me? It's my 2 hours of me, myself, and I.
Oh, you agree?
Yeah,
Wow.
it's my 2 hours of me,
2
myself.
hours.
There's so much you do in the gym. There is mobility.
Mm-hmm.
You start by, you just don't enter and lift weights. Start by stretching your your like
Mm-hmm.
flexibility, and then you warm up to at least keep the blood moving.
Mm-hmm.
Then now you enter now weight training. Like
Mm-hmm.
if you're doing quads, now you do your weights.
Mm-hmm.
Then now you finish up. Now I've added core, and then now you stretch. Then now you go back. So for those 2 hours, do not talk to me. I do not want to be talked to. I did not wake up for you to come and yap. So immediately I enter, I just have headphones. But and if I don't have headphones, I'm going back home. I'm not going to the gym that day. No, honestly.
And I think I agree.
Yeah.
Like it gives you that oomph to just, you know, I
and
agree,
also
I
it gives you
agree.
in your own world and your own space. And
Yeah.
it's just, so that's what I do in the beginning. In the morning, I mean. And then in the evening, I actually, because of the blood clots, I have learned journaling is very important at the end of the day. Because it makes you now process what you had the whole day. Because if I had not processed whatever was happening to me, that 6 months later it attacked me like, oh yeah, my nigga, you almost died. So at least journaling, not even journaling passage, but just have like I've got this journal book. It's like a coloring book stroke journaling book.
Yeah.
So I color like a moon or something that is there on that page. Then I just say today I had a shoot with Hope. It was really nice. Not talked about my blood clots in a long time. Funny thing, you'll know how that has processed whatever has happened in your life. So I don't do it all the time. I'm not gonna lie to you, but also I've seen the older I get, the more better it becomes processing things because so much happens during your day. You process so many things. Social media, you're also consuming things. So your brain is always on move.
Exactly.
So now that helps me now wind down.
Correct. I feel like I've struggled to journal. Like I do it, let me say once a month. Like I really struggle. I wish I could get like a like an automatic journal so that I don't have to do the physical writing. I know they're there, but then at the same time you're trying to like shut your mind, like and not be online on like devices. Anyway, so what I feel like I want to do, I want to get like a book for crosswords.
Oh, I have
like
that.
Puzzles so that I just do them in the evening.
Sorry, I know I'm not supposed to be plugging them.
No,
but
it's okay. It's okay.
Textbook Center does have
They have
they have a word search.
Yeah.
They have then they have a book that has mixed Sudoku, zigzag things, like just to keep your brain. And it's just fun
mentally stimulating, and also it's good. It helps with preventing Alzheimer's and dementia.
Yeah. So I use that in the office.
Okay.
Whenever I just feel like it's a lot, I just remove that book and start.
Yeah.
And then because I'm in a space with the old people, they're like, this girl is crazy.
No, they're like, yeah, oh, she's one of us. Like, see, because they would play them on the newspaper or like do them on the newspaper.
Yes, but not. I don't think it's. I feel like old people are usually. We've digressed, but old people.
And then we are we being ageist here? Oy.
No, but I think they don't know. You see, as we use it for a different reason.
Yeah.
As we do it to just put back things together.
Yeah.
For them, I think they're just doing it for.
Just to do.
Yeah. So now imagine you that and then I also bought colored pencils.
Ooh.
So pens, I mean. So I have there my pen and my book.
That's the one now they don't understand. They're just like, is she old or young? Like, pick one.
So, but Textbook Center has that.
I'm going to look. Actually,
yeah,
I really
they're just there.
Yeah.
They have like I know like four different ones.
Okay.
Yeah.
I'm gonna, and I feel like that's what I'll start like gifting people because I think we need to find ways of being bored. I think that's what we call it these days.
Yeah.
But that's still stimulating yourself in some way.
Yeah.
Yeah.
Because I mean, walking, I know I would love to start walking without any music or any podcast or any, just without any stimulant.
I do that sometimes.
Oh, wow.
I think how you can start is by having like a color walk. Like, hey, that, like, so you tell yourself, okay, fine, let me find 10 things that are green.
Wow.
Or let me find things that reflect colors of the rainbow. So at the end of your walk, it's either you're collecting them physically or like mentally. So you can be like, I saw a signpost that was red. I saw the tree was green. Maybe the leaves were red. like that.
New things. We're learning here.
Yeah.
All right.
It's the internet, sadly.
It's one of the best things and the worst things
That's
ever.
true. That's it. Yeah, double-edged sword.
Yeah.
Okay, next question is, what's a piece of health advice that you probably used to subscribe to that now you're just like, I don't think so.
Piece of that I used to and now I don't.
Yeah. Someone too. Don't worry. We don't judge here.
I should not rush to medication immediately first.
Okay.
Yeah.
Mm-hmm.
Like for someone who's like, I don't like pain, but if and also again, because of that also you end up knowing. You know how you said knowing if you have a homa, it starts here, or if it has or here.
You can feel the
Yeah.
the next few days.
Yeah,
I'll have,
yeah. So you start taking dawas or ginger or everything, or even just trying to do like immunity boosters. That's something. So you know how to control maybe your immune system if you're gonna have a problem. So those are the things I started doing now that before I used to be like lozenges or something. Or so, I just used to rush to medication immediately.
Yeah.
But now I'm like, also because we need to be realistic about putting in a lot of drugs in your body.
Yeah.
Can alter many things in you.
Yeah.
So I try to curb it. If my Kenyeji way doesn't work out, before now it becomes bad. I take medication.
We'll talk about that on the side.
I know.
Yeah, I agree with it to some extent, though.
Yeah.
I think for me, the extent is sometimes it's very hard to know what is serious and what is not serious.
Oh yeah.
Yeah, but
But
I
you
agree.
can't
Like
know.
yeah,
You
like
can't know.
a flu or a homa, like that one fine. Like I'm not saying you go for cold cap immediately. You can do your home remedies.
Yeah.
But sometimes you can have like a small stomach pain.
No, that's different. Hey. No. You see, that's different.
Yeah.
Like where you feel like, there's some things where they should never uma.
Okay. Correct.
Yeah.
Correct.
Yeah. And even a knee. Why is it
Yeah.
umaring?
Yeah.
It's not like a cord you've done a muscle that is you're feeling like it's because of the gym. But a stomach or an bro, it's even I saw the episode with Lily Aisha about H. pylori. I remember I'm a person who gets cramps. So
God's favorite.
Always. Thank the Lord.
Well,
I'm taking it. I'm taking it. But then I remember that day it was my period time, and I started feeling pain in my tummy. Then I threw up. And I knew, I remember my mom was like, maybe it's your periods. And I'm like, I've never had period cramps.
Yeah.
And I went to the doctors, I got H. pylori.
Okay.
Yeah. So you see, there's some things very well they should never pain.
Yeah.
Ever. But then the normal to things like homas and everything is what I can say. Yeah.
That's even with like homa, I rarely take medication.
Yeah.
Like
those are the
rarely.
things. But that stomach pain, what pain? No, that doesn't like.
And that's why actually it's very important to know your normal.
Yeah.
Because then you'll know what is abnormal
exactly.
to you.
Yes.
Then the last question is, what's one health rule that you keep hearing that you're just like, I think we should break that one, like even maybe once a week without feeling guilty?
What is
a health rule or like a health you see people say eat healthy, drink 7 cups of water, what's one health rule like that you think we should break every now and then without feeling guilty, like maybe just once in a while?
Hey, that is hard.
Like having a cheat meal, but don't use cheat meal as your example.
I was going to say that.
I do, because you're a gym.
Yeah, I'm going to say just a burger, man. Like another pizza. Let's see. Health wise.
Yeah.
Sleeping in.
Okay. Nani amekukataza? Who has refused you from sleeping?
Some guys are like, you need to be up 8 o'clock in the morning.
Okay.
Those things.
Okay, I agree.
There are days I just don't feel like waking up.
And it's fine.
And even this guy saying, my body clock. Me, I don't have a body clock.
For real?
Mm-mm.
Like if you don't put your alarm, you won't wake up?
Mm-mm.
Wow.
I don't have a body clock.
I think mine right now is set for 6:30.
Wow. All the people saying, just my body just wakes up. Me, I say, no. If that thing doesn't cry.
Ama, you don't have problems. As an adult, your problems wake you up.
Like if that thing doesn't cry.
Hey, guys, I'll be asleep.
I'll enjoy sleep.
Hey.
Like for me, it's I don't have a body clock. If it's sleeping, I'm sleeping. If it's not sleeping, I can, let's say maybe Friday I can bash and then morning I'll sleep in, or I'll just end up sleeping early and then
yeah.
But that's what I should feel like those are my two things.
Okay. I think those are really good ones, actually. Yeah, sleep. Like, if you need to sleep in, please.
Again,
Get
not
the
here to
rest.
suffer. So
Yeah, get the rest you need.
and that's
Yeah.
the thing many people don't know. It's very important.
Yeah. Sleep is actually so underrated. It's so underrated. If many of us like really prioritized our sleep, we wouldn't have to be taking some of like the supplements that we're, of which
Bro.
you don't need supplements if you're not supplementing something, guys.
Yeah.
Please. But yeah, sleep is so underrated.
Very. Even if for weight loss, sleep is one of the most important things ever you can do in your life. I didn't know that till I was just like, what do you mean sleep?
Yeah.
Kulala 7
Lala
hours.
too.
From the course of 6.5. But anyway,
He said even 4.
Yeah.
But we said no.
Yeah. That you're unhealthy. Go check yourself out.
That's your high friend.
But yeah.
So that's a wrap. We are done with the questions. And before we go, we want you to plug yourself if you want to be found. If you don't want to be found, it's all right.
Okay.
Yeah, plug yourself.
Guy, plug myself. Won't we have shared this?
I'll put your handle here.
And yeah, so
Yeah.
my name is Julie Nadupoi. My content mostly is just friends. Literally, that is my friends. If you come to look at me, oh God, you will not find anything apart from the gym.
Yeah.
There's nothing you won't know about my life. But my life is mostly friends. That's what I love. That's what I thrive with. And yeah, no one can take me, please. I can disappear on you.
Whoa.
This guy could take me.
She said she's not the one. In short.
Oh my God, but Julie does not. Like, no, she just posts Monday, Tuesday, Wednesday, Thursday, Friday.
And Saturday and Sunday.
Okay, Tuesday, Wednesday, Thursday, Friday, Saturdays are gym. Then Monday is a lot of nonsense.
Actually, your recaps, do you have like a specific date?
Monday, Tuesday.
Okay.
Yeah, it's, people tell me it's their favorite show. Thanks, guys. Honestly.
My show is on.
Yeah, it's just called The Giriri Stories. And The Giriri is just... Because many people ask me, why is it called The Giriri Stories?
Yeah.
If you ever watch ants, whenever they're like the Giriris.
Yes.
Do you see how they're usually many?
Yeah.
You never see one space.
Because Julie's...
Yeah, so my recap are usually...
There'll be dots. 1, 2, 3, 4, 5, 60.
Yeah, that's why they're called the Giriri Stories. Because there are
okay.
very many like the Giriris.
To be honest, I've always wondered. I think that makes sense.
Yeah.
Okay.
Yeah.
Okay.
Let me know.
Asante.
Thank you for
now-
having me. I've always wanted to be here.
Actually, by the way,
I was like, why doesn't you having me? Yeah, I can talk. I'm asked, don't get.
By the way, you can talk.
Yeah,
I
so
love
thank
it
you for
so
having
much.
me.
Karibu and Asante.
Yeah.
And welcome back for cellulitis.
I will, and this is a good thing. Like knowing you from high school and then seeing this, and then this starting in the car.
In the car.
When we're here.
Even you, please. Can we go back to the sums of money she was talking about? You guys, if I tell you. Anyway, that's a story for another day.
Well, yeah,
because, hey.
But thank you for having me.
You're welcome.
Yeah.
And thank you for honoring the invite.
I'll be back for cellulitis, guys.
Correct.
Vote for me.
Now, when you're Mesema, actually vote for me.
To come back.
Oh. And on that note, if I don't wrap up, she'll go on. My name is Dr. Hope Simiu. Please follow us on our social media. Mine will be down here. Also follow the podcast, A Dose of Health, on follow
Podcast.
Follow is for Apple, Spotify, Amazon, Afripods, and then subscribe on YouTube. So I'll give you a moment now. Just 1 minute, subscribe.
Ding.
Thank you. And that's a wrap.
Bye.